A new working group charged with solving the shortage of home health care workers heard from key stakeholders this week.
17 years ago, when I started a home care company, we had a nursing shortage where there was just not enough staff to be had. Now, the nurses that are licensed have more options. There's still a shortage in home care because of the fact that we don't always have the best environments. They don't get to go to a fancy facility. They don't get to have happy patients all the time. They have to deal with families and conditions that may not be favorable, as well as the pay and the benefits. And we attempted to solve one aspect of that issue, not to say that the reimbursement rate is not a problem, but we attempted to solve that, and I hope that this work group will take that part seriously, that it isn't just about putting more funding at this. Yes, I think that is part of this problem, but it's also about being creative. Regular nursing, the primary difference between PCA level of care and regular nursing is administration of medication. Granted, there are other cares and assessments that are done, and that was part of the contention with some of the entities here represented today. But I think it's important to note that we want most of our licensed personnel in the state to practice at their higher end of their scope of practice, not at the lower end.
Each nurse is trained specifically to each patient. And obviously, especially for our clients who require several hours of care, from 8 to 24 hours of care per day, they have multiple nurses assigned to them. So we have training shifts that are also uncompensated, where you will have 2 nurses in the home for several shifts in order to prepare that nurse to care for that client. So as we talk about uncompensated costs, it's not just the administrative costs or the other regulatory overhead costs. It's true direct costs to ensure a safe care plan for those clients.
It's important to point out that the Olmstead Commission is to allow people with disabilities to live in the least restrictive setting, and it is a mandate that's been put forth to the governor and to the legislature to make sure that this indeed does happen. It does things like allow people to access employment, access quality of life, to go about and receive transportation services, to be able to seek out and seek employment opportunities, and to other basic areas that we all must take for granted in this world. However, if people can't get out of bed in the morning, they're not going to be able to even touch the Olmstead goals that are wanting to be realized. In a rate-controlled system such as the Personal Care Assistant Program, funding sources are capped and not responsive to market pressures. PCAs earn less than most fast food and retail workers, and it's extremely difficult to compete with these types of other businesses that pay more and also offer benefits that are typically very hard to attribute in the personal care assistant world.